Welcome to Joy in Our Town. I'm Lisa Boldo, and in this segment, we're talking about health, and we're focusing on new advances in anti-aging treatments. We're joined by founder of NJ Institute of Anti-Aging and Integrative Medicine, Dr. Peter Biro. Thank you so much for being with us.
My pleasure.
So, Dr. Biro, why is anti-aging so important?
Oh, my favorite topic. First of all, when someone hears the word anti-aging, immediately they think of facial aesthetics.
Yes.
Nobody thinks of the healthier aspects to which I am applying it. So let me define what I mean by anti-aging with respect to my practice. How can we utilize the body's endogenous internal systems for growth and repair, to rebuild, to increase one's longevity, to lead them on a path that leads to increased lifespan? So I'm not talking about facial aesthetics, even though I do a lot of that.
So it includes that?
It includes that. But the message I want to carry over to everyone, forget about a facial, even though that's one of my focus. But how can I enhance the internal systems to increase your longevity, to have you live a life of vigor and stamina and joy and feeling strong and vibrant, as though you were, same as you were when you were 25.
And that's what we all want, right?
I know, I'm working towards it.
So how do we do that?
Okay, well, a couple things. Stem cells.
What are stem cells,
I've been saying for the last decade that stem cells is perhaps the future of medicine.
Wow.
And they're all these biotechs, and my hat off to them, because they're investing millions and billions of dollars in R&D.
R&D.
Research and development.
Okay.
To come up with cures for many different disorders.
Okay.
Now, what is a stem cell? First of all, stem cells are basically cells from the body that are undifferentiated. In other words, they don't have a specific activity. They're undifferentiated. Exactly.
Wow.
So, and two sources includes the embryonic stem cells, which does raise the question of ethical issues. Do we extract the cells on day 5 after impregnation? Are we destroying a fetus or a baby, an embryo there, or a life? But I'm not here to discuss the ethics here. But that's one source. The other is adult stem cells from grown adults, which can be found in the brain, in the bone marrow, the blood, the liver, muscle, and skin. So what are the advantages of stem cells? Well, in growth and repair. Growth and repair of organs, joints. People have already begun to apply that with respect to joints.
Wow.
Facial rejuvenation, etc.
What's the platelet-rich plasma that we're hearing about?
Oh, okay. First of all, it's your own platelets. What I do in my practice, we do what's called the vampire facelifts, the vampire facials.
The vampire facelift?
And I'll explain all the terminology. I said that the first couple of patients, they were scared. Vampire?
Yeah.
Hey, no. The reason why the inventor named it vampire is because we're using blood, the person's own blood. So hence the word vampire.
Gotcha.
The way it works, we extract a tube of blood from you, and we activate in your blood are little tiny cells called platelets. Imagine getting a cut or a laceration. A few days later, you have a scab.
Yes.
And it begins to heal. It stops the bleeding. That's platelets. Platelets circulates in the bloodstream. It comes to that site. It's activated at the site of injury, and it releases powerful growth factors.
Growth factors.
Growth factors, cytokines, different chemicals that begins the healing process and rejuvenation. We know that when platelets are activated, as much as 8 powerful growth factors are released. We're talking about epidermal growth factor, and I'll explain those. Fibroblast growth factors, collagen stimulating growth factors, fibroblast growth factors, keratinocytes, and many other cytokines. And again, with respect to facial rejuvenation.
Right, how does that work? How do you do a...
As we all age, we begin to have the wrinkles.
Yes.
We begin to lose the volume.
The elasticity.
Elasticity. Right? And that's because we lose our collagen. Well, guess what? We've discovered platelets, when activated and injected there, it begins to regrow, bring back that collagen.
Really? So that can re-stimulate your collagen, regrow it
Yes, it stimulates collagen formation within a few months.
within a few months.
Now, listen, we don't work miracles. There's only one miracle worker.
Of course.
But yes, Kim Kardashian recently had it. It was all over the newspapers in the news. You know, that Kim had the vampire facial. What we do, now there are two separate procedures. In the vampire facial, we use a microneedling device, and it's painless.
What do you go like right where the wrinkles are and
The entire face.
The
To
entire
stimulate,
face.
begin to slough off the dead skin in the cells and begin to stimulate the cells underneath.
But they're injections, right?
Yes, we use what's called a microneedling pen, and we begin to just run it over the entire face, scuffs off the cells, stimulate. It's painless.
I was gonna say, is it
painless?
painful? Really?
Painless.
Painless.
So we do that, and then we extract your blood, activate the platelets, and then we apply it. And it gets, so from all the microneedling, those tiny pores we've just induced, it gets absorbed. Now we can take it further and do a vampire facelift. Using the same procedure, extraction of the blood, activating the platelets, and injecting it with hyaluronic acid, which is all natural. The body makes it. It lines the joints, our tissues, but as we age, we lose the collagen, but hyaluronic acid, which can be found in Juvederm and Restylane.
And that plumps the skin.
Plumps it
Does
up.
it give your skin hydration too?
It does. Oh, yes. So we inject the combination of hyaluronic acid and your activated PRPs into the skin.
And then you're rejuvenated.
And within a few months, and for many patients, it lasts as long as a month. Now, let's take it a step further.
Okay.
Men and women.
Yes.
For all the wonderful couples out there. Recently, I had an elderly man. Him and his wife came in. He was 92.
Oh.
His wife was 91. As they were leaving,
Oh my goodness.
she sat in the waiting room and he came running back. He said, "Doc, can I have a prescription for Viagra?"
Oh no.
Hey, I was ecstatic. I love it. You look at Abraham.
Well,
Abraham was 100.
You said he was 92.
He was 92.
Oh my goodness.
Abraham was 100, Sarah was 90. They had a baby. They were intimate.
Yes.
It's a sacred act.
Yes.
Okay? So yes, so as we age, many changes begin to occur within our bodies. The facial wrinkling, the breast issues in women, but also with hormonal issues and deficiencies, there's vaginal dryness, there's urinary incontinence, and painful intimacy for a woman. Simply happens to a man. In many of his, as he ages, things begin to change. What we can do now is activate the same platelets,
Oh my goodness.
with the
That's what I
stem
was going to
cells.
ask you. It's the same technology?
same technology. Again, we inject the woman into her genital regions.
So it's not just for the face.
No, no.
It's for wherever you need regeneration?
Right. So it helps a
Wow.
lot of women for urinary incontinence. Again, because of estrogen issues and the aging process, menopausal issues. Urinary incontinence is big. You sneeze, you cough, you go for a speed bump, you pass the urine. Very common. Lots of women complain of that. Not to mention the painful intercourse with her husband.
Yeah.
So these are very powerful. We've got the technology. Men and women. It's called the Priapus shot in men and the O shot in women. Now,
This is safe technology, right?
also, it's natural. It's
Who-
all of year.
Who would be able to administer this? A doctor? Would a specialist?
A physician. You need to see a physician who's trained in this area.
Okay.
There's not too many of us around. Again, this is cutting edge technology.
Yeah.
We can take it further. What happens as a woman ages? Hair loss, hair thinning.
Oh my goodness.
I mean, this is one of her crowns, her jewel, to have a nice head full of a thick flowing hair.
You can help to restore and rejuvenate.
Stem cells, same thing, PRPs. A 40% regrowth, incidence of regrowth of hair. Thickness of hair, again, early.
How long
Same
does it
thing in men.
take to see results?
A few months.
A few months.
Yeah, with reference to hair regrowth, as long as 3 months to 6 months.
Do you have to do it again after a time, or do you just do it
Once a year.
Once a year?
If you want to come in and have it redone in 4 months, by all means, it will not hurt you. Again, it's all natural.
And
it's
it's
your stem
painless.
cells. When you think about, there's a saying, there's power in the blood.
Yeah.
Hey, well, there truly is. Just think of the life, the essence of those life-saving and life-changing capacity of our cells within our blood. If you begin to use it,
How would someone know if they're a candidate for this technology?
simple. Urinary incontinence,
Okay.
any age. When I say any age, I mean 30. My ideal patient is between 30 to 50.
That's good to know. baby boomers sort of.
But we can see patients in their 60s also. But 30 to 50 is my ideal patient.
That's your ideal patient.
Again, oh yeah, men hit andropause in the 40s. They lose their testosterone. We can see changes. It affects a man psychologically.
Sure.
Same thing with a woman. She wants to please her husband and vice versa. So there's a psychological stigma. We've got the technology to help them.
That's amazing. So this platelet-rich plasma or these stem cells, it's two different things, but it's...
Right, two different things.
But
I wanted to just mention stem cells just briefly. But PRPs,
platelet-rich plasma. That's the new technology.
Right, activating those growth factors are powerful.
So it's rejuvenating the outside, but it's also rejuvenating the inside as well?
Sure, yeah.
That's amazing.
In the areas where it's injected.
Right.
Now we can take it even further. Many women get all the facial work done and you can't guess their age. But it's a telltale sign. Look at the back of the hands. That's the giveaway.
So can you do it there too?
We can do it there. Hyaluronic acid and takes the aging away.
Really?
We can also do it in a breast lift. I recently worked with a physician and his wife. We did her breast lift. She was in the late 50s. What we did, we ran it off the breast. Again, same technology as we did for the vampire facelift.
Does she get the breast lift first and then you do the platelets, or?
No, we did it all together, same time. Injected there and it just rounded it off and it lifts, yeah.
And takes away, well, just any... Because you said that you get rid of the dead skin cells first.
But that's the vampire microneedling, the vampire facial.
Okay.
We don't do the microneedling there. We just inject, as in a facelift.
Oh, I see.
Yeah, we do a breast lift, we inject it.
So in the hands, you would do the hyaluronic acid.
In combination with your PRPs.
In combination with the platelet-rich plasma PRPs.
Other benefits include scars, stretch marks.
You won't have that anymore. It just takes it away.
Takes them away. Oh, yes.
Oh, my goodness.
So the technology is still yet to be discovered. Where else can we apply it?
It's very cutting edge.
Yes, it is.
Wow. Any last words for our viewers?
Yes.
If they're concerned about anti-aging?
Oh, boy. Just, again, healthy eating, sleeping, resting, supplementations. Don't forget PRP. In your blood, our Father placed some very powerful agents and substances that you can utilize, that we can all utilize as we age to enhance, to look beautiful. There's nothing wrong for a wife wanting to look beautiful for a husband and vice versa. Hey, make use of it.
Well, all right. We are going to continue our conversation with Dr. Biro right after these messages.
Look, here's a charge for something we didn't order.
Good catch.
I don't think you should ever pay for any bill unless you have first made sure that all the charges are correct.
Speaking of which, have you heard of the latest Medicare scams? This happened to my friend. A man came to her door claiming he was from Medicare. He had a smooth line about helping seniors with the high cost of their medicines, but she had to give him her Medicare number right then before the deadline. Well, when she got her Medicare summary notice, it was full of charges for services she hadn't received. Turns out this guy was a scam artist.
Medicare already has everyone's number. They wouldn't need to ask for it.
Scams like these hurt every taxpayer, draining billions from Medicare and making it harder for people like us to get the health benefits we're entitled to. So I did something about it. I joined the Senior Medicare Patrol, where I work with other volunteers to teach my neighbors how to protect their Medicare numbers, review statements to spot false charges and detect errors, and report suspected fraud.
Mom was diagnosed with Alzheimer's at 58 years old.
8 years into the disease was when all the light went out.
For me, it was heart-wrenching.
Looking into the eyes of somebody with Alzheimer's, sometimes you just don't see the person's soul is like gone.
And it takes a toll on everyone. I mean, it's a depressing disease to watch unfold before your eyes.
She actually thought those of us who were caring for her and who loved her most were her worst enemies.
More and more responsibilities fell on my shoulders.
This disease just ravages a family.
It changes your life.
The magnitude of it is indescribable. My mother taught me to be in the moment.
We have to live in the moment with them.
And I'm going to be with that person right now in this moment, wherever she is.
Now is the moment. If we work together, we can stop this epidemic.
Contact Bright Focus and learn more.
Welcome back to Joy in Our Town. My name is Lisa Boldo, and we're talking about health. But in this segment, we're going to focus on hormone balancing and restoration. We're continuing our conversation with founder of NJ Institute of Anti-Aging and Integrative Medicine, Dr. Peter Biro. It's so great to have you with us.
Thank you.
So, Dr. Biro, what are hormones, and what role do they play in anti-aging?
Okay. Hormones are simply powerful messengers.
Okay.
Basically, they're of a protein nature, and the majority of our hormones comes from cholesterol. And here we are beating up cholesterol all these decades, thinking that, hey, cholesterol is perhaps the culprit of heart disease, when it may not even be, or it may not even be the only one. But that's a whole new topic.
Yeah.
Now, as I said, they're powerful messengers, and there's a vast array of hormones within the body. In men and women, we have almost every identical hormone, just in different quantities. Okay. Most men, when they hear hormones, think testosterone, low T.
Yes.
And a woman, when she hears hormones, she thinks of thyroid and estrogen. The beauty of this temple is that we've got so many hormones, and it's like an orchestra just playing. And they're all beating at different times. Traditionally, we've gotten to a point where we just check the thyroid, but we ignore everything else. Again, because of the restrictions, health insurance, and so on. In integrative and regenerative medicine, we step out where we look at other levels, tissue levels, and so on. Now, hormones play many roles. Now, for the person who may be saying, well, I wonder if I qualify for hormones. Why do I even need hormones?
Yeah, well, that's a great question.
Well,
why would someone need
men
hormones?
begin to hit andropause usually in the 40s, and women hits menopause on average of about 50. And by that we mean ovarian failure or testicular failure in a man, where it begins to underproduce his testosterone and many other hormones, and a woman, her estrogen, progesterone, etc. So, functions of hormones and why one should consider hormonal HRT: growth and repair. It plays a great role in internal rejuvenation, relief of physical symptoms.
Really?
In a man, he may be anxious, he may be depressed for signs, or may develop diabetes for signs of testosterone deficiency. In a woman, mood changes, the night sweats, the hot flashes, the irritability, the moodiness, and so on. So relief of symptoms. As a woman gets into menopause and postmenopause, the heart attack risk goes up.
Wow.
So heart disease prevention, another reason to consider HRT. Bones, she becomes menopausal, osteoporosis.
Yeah.
You fall, break a hip bone or femoral fracture, increased risk of increased mortality.
Wow.
So, relief of symptoms, growth and repair. Memory, you go into menopause, all of a sudden many women say, wow, I'm just so scatterbrained.
Yeah.
Why am I in this room? I just having these memory lapses. So memory, bone, heart, growth and repair, release of physical symptoms. Now let's talk about a woman's estrogen.
Yeah.
Estrogen's got over 400 functions in the body. Upon the brain, upon the heart health, skin health.
Yeah.
Estrogen has been shown to reduce wrinkles, the facial skin, all the wrinkles and so on. When you begin to replace estrogen, it increases the thickness in one's skin, but keeping it soft.
And supple.
And you have that glow. Woman, estrogen in a woman has been shown to increase choline acetyltransferase, which increases, or decreases, I should say, the risk of Alzheimer's dementia.
Interesting.
It increases serotonin, norepinephrine, and dopamine, which also plays a role with one's mood, decreasing risk of depression.
Wow.
It lowers LDL cholesterol. It reduces homocysteine and lipoprotein A, two big culprits of heart disease.
Wow.
So not only cholesterol is the main culprit for heart disease, but homocysteine, inflammation, and lipoprotein A. It also lowers triglycerides, has been shown to lower blood pressure. So it reduces heart disease by as much as 40 to 50%.
So there's obviously then a link between hormone balancing and restoration and longevity.
Oh,
Longer
definitely.
life.
There's a strong link. Now, I always recommend, I've seen patients from other physicians, and I will never knock another physician.
Right.
Okay? We're learning every day. Coming with very high levels of hormones. I always recommend, first of all, checking the levels. My first initial test would be a tissue level. But again, cost becomes a factor. Many insurances do not pay for tissue levels. So we go with LabCorp Quest and check the serum or the blood testing, which is not the most accurate, but it gives us.
What is the tissue level going to show?
Well, it tells us tissue levels, how much of the level of hormones
the level
within
okay.
our tissues.
Gotcha.
Again, that tells us more than the blood. It's more accurate. So it tells me, are your tissues super saturated? Or are you getting too much? Are you getting too little?
Of certain things.
Hormones, right.
Of
Depends on what I'm checking.
Ah.
Estrogen is very good for tissue levels, and progesterone, testosterone. Estrogen, again, powerful benefits on one's brain, heart disease, bones. Next, progesterone. I am so tired of hearing patients who've had a hysterectomy being told by gynecologists, you do not need progesterone. Because when you look at what happens in the menopause with progesterone deficiency, is all the neuropsychiatric changes, irritability, moodiness, depression, insomnia, pain and inflammation, joint problems. All the signs and symptoms that's outside of one's uterus.
Wow.
And if you look at the symptoms so far with estrogen, progesterone, a lot of neuropsychiatric symptoms. So that's why many women who go into menopause or postmenopausal sometimes are diagnosed with generalized anxiety disorder, depression, or bipolar symptoms.
Oh my goodness.
Also, we have found that the incidence of divorces goes up.
Because of the irritability, the moodiness, and all that.
Mainly because of the hormone imbalances.
So for our viewers, what are some signs that might show them that maybe they need some hormonal balancing and restoration?
Fatigue, energy loss, the skin changes. We know testosterone in a woman.
When you say the skin changes, you mean like
the skin sagging,
dry,
the wrinkles, the
okay.
dry. Yes, the chicken arm effect. You know, that's a function of testosterone.
Really?
Testosterone with DHEA gives you that tonal, increases in muscle mass and tonality, gives you the firmness, makes a woman more confidence, increases her self-esteem.
Sure.
So testosterone, again, we look at the benefits there. Neuropsychiatric, confidence.
Wow.
Going back to progesterone, I want to say that many women in menopause have problems sleeping, and the Russia, the Ambien, and the Lunesta. But progesterone has been shown to induce a very strong sleep. And if they have irritability, mood changes, and anxiety, taking the pill form, my favorite is always progesterone cream. It has excellent transdermal release and equilibration. However, for insomnia, we like to use the pill form because what it does, it gets to the brain and binds to GABA, GABA.
GABA, yeah.
And we know GABA has a calming effect on one's brain and one's mood.
Yeah.
So when I do hormones, in addition to what I do, I like to check in many patients if they can afford it, because insurances do not pick up these things.
Right.
I like to check the neurotransmitters. Neurotransmitters, again, are chemical messengers.
Sure.
Serotonin, for example, plays a role in depression. Paxil, Lexapro, Zoloft is meant to increase one's serotonin level,
Right.
fighting against depression. Guess where serotonin is made? Majority, if you had to guess.
Your brain.
No?
Oh.
Acts in the brain, but the majority of it is made in the gut.
The guts.
And many
Your second
people,
brain.
oh yeah, and many people walk around with dysfunctional guts.
Right. And then they wonder
Mood
why
disorder,
there's
right? Fix the gut.
sense. It makes sense.
So I like to check neurotransmitters. Now, neurotransmitters can be broken down into two different groups. Those that are excitatory and those that are more inhibitory and relaxing. Glutamate excites the brain. So many women and kids being diagnosed with ADD,
Yeah.
women in postmenopause, what's happening? They have a scattered brain effect. Well, hormones and neurotransmitters, it's all off.
And nutrition, can that play a big role in getting your hormones
Yes.
out of balance?
I am. Well, when you go into menopause, there's some deadly types of estrogen that are produced, especially estrogen. Estrogen comes in three forms: the 2-hydroxy, 4, and 16.
Okay.
The 2-hydroxy is said to be the safest. The 4 and 16, you want to have that in a lower amount.
Oh,
We can calculate certain ratios and predict your breast cancer risk. just based on that estrogen ratios.
Wow.
What can you do? Well, diet. Kudzu. You can have the cauliflower, the broccoli, I3C. This tends to increase and also protect the healthy types of estrogen.
Sure.
The 4-hydroxyestrone has been shown to increase DNA mutation, thereby increasing one's risk for breast cancer and cancers. A higher incidence of the 16-hydroxyestrone increases a woman's breast cancer risk.
It's amazing, all the different tests and the different...
And that's why it's so important. And I stress that patients do their due diligence.
Definitely.
Find a physician who's fellowship trained, not overnight. Not who just read a book or did a weekend course.
Right.
I've done an extensive years fellowship in integrative cancer therapies, in anti-aging and hormonal rebalancing.
Right.
And with my experience, I'm tired of picking up the mistakes I'm seeing in others. Yeah. You know, I had one gal in my class who was an allied health physician, and she was treating her mom with estrogen, and she was high. She was up to 10 milligrams of estradiol, which is a no. Within years, you have developed what's called estrogen dominant phase, increasing your risk for endometrial and breast cancer.
Wow.
And she said to the professor, my mom keeps having all these hot flashes and night sweats. He said, what are you doing? I said, well, I have 10 milligrams, I keep upping it. So you keep upping it. First of all, estrogen should be on the lower side, 2 to 3 milligrams. And if you look at physiological, what the body makes, this is very tiny dosages.
Wow.
So find a physician who's fellowship trained with experience. I'm not pushing the viewers to me. I'm
You're
rejecting.
just telling them to do their research.
Exactly. You know, my goal here is to educate them and perhaps teach them ways of protecting themselves.
Sure.
So I enjoy physiological, very conservative, subtle hormonal replacement therapies. Testosterone in a woman can make her very aggressive. She only needs very tiny dosages.
Wow.
What I do is I like to combine these hormones in one simple cream. You don't need to take them one simple cream.
So you have a balance of progesterone
Estrogen,
and
progesterone,
estrogen.
testosterone, based on their deficiencies and based on their symptoms. Remember, it's just not a numbers game. It goes beyond just anyone can balance numbers.
Sure.
First of all, listen to how the patient is feeling.
Right.
What are they manifesting? What are the symptoms? Is it reflecting deficiency or deficient state? We have pregnenolone. Said to be the mother hormone, comes from cholesterol. Pregnenolone is important for memory.
Yes.
That's why we found that when you beat up cholesterol, there's been few blogs out there saying that lowering cholesterol has been causing or inducing memory loss. So pregnenolone is another important hormone, plays a role in memory. So I may check the levels of pregnenolone because as we age, memory.
Absolutely.
So you're looking at estrogen and a whole gamut of it.
Give our viewers just a quick tip on what they can do to balance their hormones.
Balance hormone, again, eat healthy, organic, exercise, sleep well. Check your vitamins, vitamin D, omega fish oils. Men, cooked tomatoes are very healthy for prostate as opposed to the uncooked. The supplementations, again, if you have no contraindications to HRT, hormonal replacement therapy, please reach out to your physician, to your gynecologist who are trained in what we used to call bioidentical, bioequivalence, or natural HRT. My blessings to you.
Thank you so much, Dr.
My pleasure.
Bio. And thank you for watching Joy in Our Town. We will see you next time.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, Post Office Box A, Santa Ana, California, 92711.
New York City dropouts into graduates. So exciting things are happening, Kevin, and we're so glad you could join us today.
Well, thank you for having me here. I'm excited to be here.
Well, let's talk about what's happening in the New York City school system, because education as we know it today has dramatically changed, let's say in the last 1 or 2 decades.
It has. And as I've been in the public schools, primarily in the South Bronx around the Hunts Point and Longwood area, I've been in those classrooms almost every single day for the last 4 years. This is our 4th year in the school. And I see teachers, administrators, parent coordinators, principals working as hard as they can to get these kids to graduate and also to meet the standards that they're up against. But not only are they up against that, but they're up against all of the outside factors. And so you've got kids who are dealing with parents who are abusive, whether it's verbally or emotionally. They're dealing with parents who have their own addictions. They're dealing with, you know, the fear of just simply walking home. Every year for the last 3 years, we've lost one kid that was either in our program or associated with a kid in our program.
That's just heartbreaking.
It is.
And it's a shame that some of the negative situations, the isolated incidences, really seem to get more attention that they need. And the bad press really shines a dark light on these administrators and teachers who are doing such a wonderful job, giving their heart and soul into really trying to get these kids through school so they can graduate and go and have a good life.
And especially in my context, because it is such a dangerous area, you've got people literally putting their lives on the line every day to help these kids. And so my mom was a teacher for 40 years, and then she's been retired for 10 years, but still teaching. I don't understand how that works. And so, but I know that teachers, educators, most of them, you've got a few bad apples in, you know, in every bunch, but most of them are really there because they want to help these kids succeed.
Well, I'm of the opinion that, this is my personal opinion, that teachers and firemen and EMT personnel, some of the lowest paid heroes in our country, period. These are the real heroes.
Absolutely.
And we need to give them kudos whenever we can.
For sure.
Well, Elevate New York, you know, that's what you're doing. You somehow figured out that you could change some lives of some at-risk youth who really otherwise wouldn't have a chance.
Well, Elevate New York started as a model replication of an organization called Colorado Uplift. And one of my friends who used to bring me in as a motivational speaker back 10 or 15 years ago, he called me back in '08 and said, Kevin, I think you might want to look at what we're doing here with Colorado Uplift, because it may be the next thing you want to do in your life. And so, you know, I'd spoken, as you said in the intro, I'd spoken to over 3 million kids in 20 countries around the world, and you know, you can only, you know, get so many standing ovations, you know, before you begin to think, what type of impact am I really having? And so when I heard that they were having generational impact, community impact, educational impact, I was like, man, I've got to look at this. And when I began to see the results, I really felt that I was supposed to be the person to bring this to New York City.
Well, we're certainly glad that you did. And I know that there are a lot of students who have now graduated high school and who are in college today because of Elevate New York, who are very glad for your organization as well.